it is nothing but like when a patient comes to the radiotherapy department, once the immobilization and everything is over, the patient will be taken to the simulation where the actually CT scan is done along with the immobilization devices. In the same way how the patient is going to get treated, the same way the simulation is done. So the simulation, once the simulation part of the CT is over, the images of the CT of the patient will be transferred to the treatment planning system. So treatment planning system is nothing but a system where it contains both the patient data as well as the linear accelerator machine which is going to deliver the radiation. That physics parameters of the data also will be there in the system. So it is something like a pilot who is getting trained for driving a aeroplane, something like that. So it is getting simulated before the patient is getting irradiated. The patient data and the machine data will be in the system, and we will try to simulate how the radiation beam will be delivered on the patient and how it is going to be distributed inside the patient, so that we can precisely calculate how the patient dose is delivered to the tumor or the target, whatever, and then what are the critical structures which is going to get the radiation doses. Each and every structure or organ inside the body will have the radiation tolerance limit. So beyond that, there will be a end limit or the damage to the particular structure or particular organ of the body. So we have to respect those dose limits of the every structure, and then we have to deliver the maximum dose possible to the tumor. So this is a radiotherapy planning. It's the aim of radiotherapy treatment planning. Delivering the radiation dose has different techniques by which it will be delivered on the patient. So the technique there are basically 3D conformal radiotherapy, intensity modulated radiotherapy, volumetric modulated arc therapy, stereotactic radiosurgery, and then stereotactic radiotherapy, and then stereotactic body radiation therapy. So in short form it will be called as 3D CRT, IMRT, VMAT, SRS, SRT or SBRT. So these techniques will be decided before delivering on the patient. So accordingly the planning techniques also will be different. So the 3D CRT is the simplest form of the radiation delivery, where the open field of the radiation will be delivered. For example, there will be a square or any tumor shape of the radiation field will be opened, and the gantry position where the in particular angle will be delivered on that particular static field, and the radiation will be, once the radiation is over, the other gantry field or the gantry angle will be taken, and from there again the radiation field will be delivered. The whole radiation dose will be summed up, and the target will have the more radiation at the center and the minimal dose to the critical structure. So here the more of the manual method of delivering the dose with the help of computer. So this is confirming. The planner will try to confirm the dose distribution to the target on the patient, and thereby delivering the full radiation dose.